Okay, this is the side. So you see those muscles there, when you touch the neck, what are you touching at? Okay, if you use deep massage or you put pressure on it, what are you reaching at? From the skin, superficial muscles, and the deep muscles inside. And how much pressure would you want to apply in order to reach the deeper muscles? And which muscles are you touching? So these are some of the things that it's very good for you to know what you are touching. Why are your hands there? Or why are your fingers there? Okay? This is important. If you need this later on, I can, if you have a thumb drive, I can pass this to you. Of course, you want to take pictures of what is being taken. Now, what is this? What are all of this you think? These are the nerves, right? So, right there on the head, not only the muscle, not only the skin, not only the muscle, but you come across the nerves. And that is where a lot of people complain about pain. You know, pain. And looking at it, you will see, for example, just for example, the facial nerve. The facial nerve is very interesting. You look at this one here. Like that, right? So it's just like you putting your hand on your face, like that. Like that, no? Like that. You have 5 fingers, you have 5 branches, like that. That is your facial nerve. That's like so when you do massage or do treatment, you know what the anatomy is like. Because if basically we do not know, then we do not know how we are touching. We do not know what you are touching, we do not know what you are treating. Right? You know? So it's quite nice to know that. It's just like that, you know, like that, like that, like that. In front of the ear, and one behind the ear, the thumb. So that is the nerve on the face, the forehead. Okay, you can see. Okay, you have to. Forward data.
Forward.
Whenever those who are at the back, let's occupy the seat para hindi malayo.
Forward sila. Cheers, forward, cheers.
Oh, you can move your chest. You can also see the large muscles, you know, the movement of your head, things like that. Now, let me maybe not spend too much time with you on this. I want to show you a bit more. So, I want you to see here the vessels that go up the neck. Many times in a massage or in the treatment that you give, you deal with where the big blood vessels are. Because the treatment that I want to show you is based on the fact that the sphere policy tells us perfect circulation, perfect health. Okay? That is circulation. You know, circulation involves these two, the arteries and the veins. They tell us that many sickness and diseases is because the circulation was not doing well. And maybe many of us begin to believe that it's not doing well, like those around the heart, your coronary arteries, when they are not doing well, you can have a heart attack. If it's not well in the brain, you can have a stroke. If it's there not well in the lungs, we can have embolism. So it's all so much depends on proper circulation. If the blood is not working, then the organs are not working. So the basic principle that I go on is circulation. If you can improve the circulation, the body can heal itself. You know, the body can heal itself. God has given the body the capacity to do all of those things. Okay, as long as we do not obstruct the way. You know, if our life habits, the food we eat, and our lifestyle, in other words, obstruct the way, then you and I can be taking medicine, just painkiller, anti-inflammatory, and things like that. And we take them a long time. But if we open up the circulation, and the circulation is restored, the body can take care of itself a lot. It's just like, for example, a person having a stroke. Now, you know that there are two kinds of stroke, basically. One is called ischemic stroke. And the other one is hemorrhagic stroke. Hemorrhagic meaning the blood vessel has broken, burst open. Okay, that is hemorrhagic. And hemorrhagic stroke can be very deadly. The person might not recover. But the other one is ischemic stroke. And that stroke, once you clear out the circulation, the person can walk again. The person can talk again. The person can go on almost back to normal, like 80-90%. So what can we do? Because most of the strokes that happen are ischemic and not hemorrhagic. So that's why when we talk about circulation, the consequences are great. You know? That's why we need to understand that. Okay, we keep the circulation going out, and when we give treatment, we want to improve that circulation. Okay, and we will allow God to do the healing. We cannot do the healing. You know, it's only God who can do the healing, but we will arrange things in the body or live in such a way that we are not putting obstructions in our circulation. So you can see some of these veins that are very big. Right? So when you ever touch the head and the neck, I want to talk about this a bit later on. I have some other diagrams. Now, if my English is not good enough, let me know. Okay, I need to repeat some statements, because I talk, I understand, but I talk, you might not understand. So just don't feel free about that. So you see the arteries in here, alright? They are different colors. They pass through different areas, and we call them the superficial, temporal, the occipital, the posterior. So these are arteries, you know, from the maxillary. That is the other one is the maxillary artery. So if you touch certain parts, just remember a little bit what